Welcome back to our Conversations on the Couch series brought to you by GenesisCare. I'm Lindsay Morton, and today I'm joined by Dr. Scott Caesar, who's talking to us today about prostate cancer. So what do we want patients to know about this?
Well, prostate cancer is one of the most common cancers in men. It's something that is very prevalent, but also something very treatable and very easy to detect and diagnose. And it's important that men know what to look out for and what they should do when they discover it.
So if a patient is diagnosed with prostate cancer, is this treatable?
Absolutely. So first things first, not every man has to be treated. In fact, I tell most of my patients, the majority of men usually die with prostate cancer, not from it. They've done studies that show that 70% of men after the age of 70, even if they died of something else, heart attack, strokes, things like that, when you do autopsies, most of these men have prostate cancer. Over 70% of men, if they reach the age of 70, will have it. So it doesn't mean anything's happened to them. They'll just die with it because it's not very aggressive. It's not, it doesn't grow very quickly, things like that. So the first conversation I have with men that I diagnose with it is, do we have to treat this at all or not? Because the majority of prostate cancer is slow growing. It is not aggressive. And if some factors are found, like low-grade cancer, not voluminous cancer are found, then we don't have to treat it all. We can put them on active surveillance, which is watching them closely, checking a PSA, doing an exam every year, maybe do another biopsy in a few years. So a lot of men can just watch it. Now, if we do find things that might get more aggressive, a higher Gleason score, which is how aggressive the cells look, or being a lot of cores in the samples that show it have cancer, there are different treatment modalities. The two main treatment modalities are surgery versus radiation. Both of them are fantastic at treating prostate cancer. There have been many studies that show that the cancer-free survival in patients is actually the same in 25 years, no matter what you choose. So a lot of my patients, when I talk to them about how to treat prostate cancer, a lot of factors are involved. How old they are, what side effects are involved with each treatment, what are their goals, what are things that they're looking for in the future. That will kind of determine the treatment. Now, of course, there are really bad eggs to prostate cancer, things that are really aggressive. With that, they're still very treatable. It just needs to be more aggressive with hormone therapy, other things, and that's when we get other specialists involved to help out with this. But the good news is that the majority of prostate cancer, over 99% of it, is very treatable and curable.
Excellent. Dr. Caesar, we want to thank you so much for your time today. Thank you all for tuning in. We'll see you next time as we continue our conversation on the couch.